Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
So you have people signing up at the county health department. You have people signing up at various hospital groups that they may have doctors with. So how does it work? Are they going to email me? Are they going to call me? How does it work?
Well, there's really no big master plan. There's just a lot of ways to do things. It's not centrally organized at any level. This is the system that we have. I would say it's relatively broken, and we're going to bumble through this until somebody really just grabs it by the neck and takes over completely.
So what do you recommend if a person's over 65 or they're a school teacher, they think they're an essential worker? Do you go to like the city website? Do you go to a pharmacy website? What do you do first?
You know, Robin, that is a great question, and it's amazing that there's really no answer. I would go to any possible place you can go. And I want to say, first of all, this is not unique to Illinois or Chicago or Cook County. This is happening everywhere. I have a brother in South Carolina who is a legal resident of New Hampshire, should take the vaccine for a variety of reasons, and they can't get it in South Carolina. They can't get it in Florida because they're not a resident. And they found a place in Georgia that would take them. So they drove to Georgia and they had the vaccine. I mean, it's happening everywhere. It is just insane. So
for a healthy young person, what is your best guess today as to when they will be able to get the vaccine?
Well, the prediction now is that the otherwise healthy person under 65 will be able to get the vaccine sometime mid to late summer. Now, that is just a projection. The way things are going, it doesn't look like they're going to make that. However, one thing is going in favor of that, and that by April, the manufacturing rate of Pfizer, Moderna, Johnson & Johnson, which is the next coming along, and AstraZeneca, if we ever approve that one here, should be pretty much into at least medium gear, and that they should be cranking out vaccines. So there's a chance within a few months that the market will actually be flooded with vaccines. You might even be able to select which one you take. But until that happens, the healthy population is not going to get the vaccine.
Quickly, before we get to viewer questions, this new variant they say is 30% more deadly.
Yes. This is a problem. So the data are new and not really verified. But the United Kingdom, despite all its issues going on with Brexit and everything, they actually have a very good genetic surveillance system in the country, better than ours. And they have estimated that, for example, in somebody under 65 years of age, out of 1,000 people of them that get affected, 10 would die from the infection. That's the current estimate, about 1%. You know, and what they're saying now with this new variant, that number is really 13 or 14, so it's up 30 to 40%. This is in the group below 65. Or in the 60s, not necessarily the elderly people. So every age group you have to look at where that number is going to go. But the bottom line is it's about 30%. It may be 30% more deadly.
All right, let's take a look at viewer questions. Why do you think the surge after the holidays that so many experts and officials predicted never came to fruition? Also, isn't midwinter typically the peak in reported illnesses? It seems strange that the positivity cases right now are so low.
Okay, this question is just loaded with issues that have to be addressed separately. First of all, the number of cases right now is not low. It is lower than mid-November. Yes, that's true. But it's a catastrophe what's happening now. 3,000 new cases per day. This is where we don't relax at 3,000 cases and 35 deaths, whatever it was. It's terrible what's happening right now. This is not control. So that's one thing. I don't know. What can you put the question up again? I have to go back to the beginning of that question.
Well, I think it's this idea that why didn't the numbers surge? You know, did they...
Okay. I'm sorry. The surge didn't really happen too much after Thanksgiving either. And I think what it is our mitigation efforts here were fairly strict compared to many other states. So, you look at the states around Illinois, they were much worse. You look at the south and western part of the United States where, mitigation is a political thing and you're just not supposed to wear masks or whatever. Here, people really got their act together. And I think we have the benefit of that. We have numbers going in the right direction. So I think it's our behavior.
All right, Dr. Murphy, thank you so much. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Have a good day.
Thanks, Doctor.